cancerous cells in that area. It may just simply be tissue from that area that's been displaced because of a growth, maybe just a few millimeters or centimeters over. So whenever the surgeon does that incisional biopsy, we need to make sure, or he needs to ensure, that he gets a good representative sample of that area. We can have a needle biopsy. A couple of different things that can be done there. They can either take a needle biopsy and do a core, where they actually remove a section via a specialized needle that removes a column of material that can be examined, or they can do an aspiration needle biopsy, and that's basically where we go in there and we attempt to pull some of those cells into a syringe for microscopic examination. The big advantages of needle biopsy: it's fast, it's usually less expensive. However, keep in mind it may not reveal enough information. Tumor removal. There's a couple of different types of tumor removal. Local is used for small growths, so like that little skin cancer. If we've just got a small couple of millimeter spot, it's pretty easy just to remove that entire area, all the way up to wide, which is radical, and that's where we start to remove more and more things, including lymph nodes. Tumor debulking. Couple of reasons why you want to debulk a tumor. You want to remove as much material as you can. So things like radiation therapy don't necessarily have to be as long of a course, because we're not trying to remove as much material there. If we've been able to remove 2/3 of the material, then we only have a third of it to either have to deal with, either through radiation or chemotherapy. We also have prophylactic surgery now for cancer, and we'll see that in our patients that have tested positive for the breast cancer gene that your book talks about. Some other surgeries related to cancer or reconstructive surgery, especially after a breast removal. We can also have surgery that's palliative, so we know that there's really no hope of curing this patient. If the growth is, for example, in the chest area, we may remove it to make it easier for the patient to breathe. So it's out there as well. Radiation is a common treatment that we deal with. Basically, radiation affects cells that are in the mitosis phase. They're the most sensitive. Don't get hung up on all these phases. We're not testing on it, but just know that some drugs and some treatments work better at certain phases. The problem with radiation that you have to be aware of is that we don't want to. There's a balance between killing unhealthy cells and those cells that are trying to live and survive in that area. So if we're trying to treat a patient with some type of prostate cancer and we're irradiating them with a beam externally, we're damaging tissues that are in the way of that, including things like the rectum, and so you don't see that used as often. When we're radiating an area in the brain, are we giving the skin on the patient's scalp enough time to heal from that repeated exposure? So there's a balancing there between killing the growth quickly enough and actually allowing the patient time to recover. One of the things that radiation is not very beneficial on are hypoxic cells. Those that have decided that they can't get enough blood supply from that surrounding area, that they've switched over to an anaerobic type of cell growth, and that basically just indicates they do not need oxygen to replicate, and so those cells tend to be a little more resistant to radiation therapy. Typically, when we radiate, we divide these treatments up over multiple weeks or multiple days. It's small doses delivered over a period of time. The reason there is we're trying to allow time for these normal cells to have a chance to repair themselves, so that we don't completely just cause a massive burn on this patient. But at the same time, we're attempting to get rid of that cancerous growth. Again, hypoxic cells are known to be radio-resistant and require about 3 times as much radiation as a well-oxygenated cell in order to be effectively eliminated. Types of radiation: we have external, meaning that the patient is usually taken to a device and the patient is irradiated through an external machine. When you think of sources of external radiation just in the hospital environment, you have things like a CT scanner, the X-ray machine. That's all an external type of radiation. These machines are highly specialized and they're obviously a little bit different in that they're probably better shielded but we need to know that there are different types of radiation, and external is one of those. Radiation may be done before surgery. The reason being is we can try to reduce the size of the tumor. This makes it easier to get the tumor out. Should make it easier to differentiate it between the cancerous growth and the healthy growth. So you'll see patients that may have radiation before treatment, surgical treatment. Other types of radiation include internal. These are usually sealed in some type of a device. They're either placed into molds, needles, wires, or special applicators. You can also have internal radiation that's unsealed, and this would be something that the patient would drink by mouth or something that we inject via IV into a body cavity in order to kill these cells. The big things with radiation is the protection of our staff. We need to make sure that our exposure times are limited, our distances are safe, and that we're properly shielded. So, even on little sources of radiation like X-rays and stuff, we need to make sure we're wearing the lead aprons. If it has the thyroid cuff, that we're using that thyroid cuff. If our patient has internal seeds, like for our prostate cancer patient, we need to make sure that those patients are in a private room. Also, patients with internal radiation, we need to keep a set of long tongs and a lead box in the patient's room. We need to rotate our nurses on staff with these patients so that one person's not always exposed to that radiation. And we need to make sure and wear our dosimetry badges. These are little badges that take count of how much radiation we're exposed to, and they track it in a cumulative fashion so that I know over the course of time how much radiation I've been exposed to. In addition to having no pregnant caregivers take care of these patients, women of childbearing age also need to be cautious about taking care of these types of patients, especially those that are trying to